start with that. Good evening, good morning, good afternoon, depending on which time zone you're in. My name is Christopher Drake, and I'm very privileged to have this opportunity to speak to you today about the Buteyko method, the method of Konstantin Buteyko. And tonight, the emphasis is on chronic fatigue. I began teaching this method around 20 odd years ago, and the emphasis that we had back in those days was toward asthma, primarily because asthma gets very quick and fast results. But the Buteyko method is not specifically for asthma. I'm getting a bit of the feedback there. The Buteyko method is not specifically for asthma, although it's very effective for the reversal of asthma symptoms and the asthma condition, the defensive mechanism of asthma. Chronic fatigue, well, that's a very different thing. We know a number of things about chronic fatigue. It, like most of the chronic illnesses that blight contemporary society, asthma, angina, allergies, diabetes, multiple sclerosis, lupus, emphysema, hormonal disorders, sleep apnea, insomnia, and all this category of the diseases of civilization, as they were once called, doesn't have an official cause. Official medicine doesn't have an scientific explanation for the cause of chronic fatigue. And if we look at the condition, well, it's constant tiredness, aching joints, whole range of other symptoms, and then they produce this classification called chronic fatigue. So you can go from doctor to doctor and from place to place and dragging yourself through your day-to-day existence, wondering what on earth is wrong with me. My joints ache. I'm always tired. I'm fatigued. I easily get depressed. Emotionally unstable and so forth. What's wrong? And finally, you can get the diagnosis chronic fatigue. And getting a diagnosis, I guess, provides some relief for people in the sense that they will now know that, instead of just being some weirdo, you've got a condition, you've got something that you can, write down for an insurance company, or there's some kind of concept that you can follow research or medications or treatment, or, you have some label to put on this, what you might call some kind of a syndrome. But what we know about chronic fatigue, and I guess I've managed to work with about 5,000 or so chronic fatigue patients, invariably they always have bad breathing. They always have a low control pause. A little later in this session, we're going to discuss the control pause as a measure of the breathing. But basically, it's always the same. They have similar complaints. They have this diagnosis of chronic fatigue. They begin to practice the Buteyko method. They always have, as I said, lousy breathing, low control pause. And as their control pause starts to improve, their symptoms begin also to improve. They need a little less sleep, they feel a little brighter, and generally they're at least going in the direction of recovery. In fact, some of the students that I've dealt with with this so-called diagnosis chronic fatigue. Apparently they acquired it through being poisoned. One, as a child, was involved in agriculture in the United Kingdom and somehow received some very heavy dosage of medication, of pesticides or herbicides. I don't know which ones. And he was able to overcome all his chronic fatigue and electromagnetic sensitivity, I believe they call it, and a whole range of other cascading disorders which come from chronic bad health. And he began with a very low control pause, and within a few weeks his control pause came up and the symptoms of the chronic fatigue began to lift. But interestingly, and is so often the case, these symptoms can initially and quite spectacularly improve, and that is followed by what we in the Buteyko world know as cleansing reactions. You see, when you have a deficiency of carbon dioxide because you breathe too much, the organism tries to defend and compensate against this deficiency, and one is left vulnerable to the build-up of toxins, poisons, and infections, and so forth. And when you begin to elevate the level of carbon dioxide or bring the level of carbon dioxide to a more normal state, carbon dioxide and this chronic infections and chronic toxicity cannot coexist together. It's a bit like if you're forced to live in an apartment with a completely dreadful, crazy person. Ultimately, one of you has to leave. Either you're going to leave or they're going to leave. So when this level of carbon dioxide improves in the organism, sure, you feel brighter, lighter, stronger, muscle pain, inflammation comes off, you need less sleep, you have more energy and so forth. But now comes the war, if you will, in which the level of carbon dioxide cannot coexist with underlying infections and the toxicity and so forth. And so quite often the case, people with severe chronic fatigue, I'm not even entirely comfortable with continually referring to this condition as chronic fatigue. Medical authorities have got some pretty fancy names for it. The ME Association feels that myalgic encephalopathy is a better word. Some people call it chronic fatigue syndrome. Some call it post-viral chronic fatigue, PVFS, and some call it CFIDS, chronic fatigue immune dysfunction syndrome, or CFIDS. I mean, it sounds like one of the alphabet soup organizations of the United States government, ME, CFS, PVFS, CFIDS, chronic fatigue. And according to a little research I've done, officially there's no accepted cure and no universally effective treatment. I have, of course, having taught thousands of people with chronic fatigue Buteyko Method, I've actually learned more from them than I knew about the disease myself, because we just teach the normalization of breathing. And so these people would often go through all kinds of medicamental interventions. Some would have the mercury removed from their teeth and so forth. And that sounds like an unassailably logical thing to do, to remove poisons from your mouth, from your teeth, and have them replaced with something non-toxic. But from my small sampling of patients and what I've seen, at least the ones I've been engaged with, that didn't seem to help very much. They still had the chronic fatigue afterwards. And also, as a matter of interest, I've seen thousands of people with emphysema and COPD, and quite often they've got a mouthful of mercury fillings, particularly the older people, and they don't have chronic fatigue, they have COPD or emphysema. So I'm not sure there's a linear relationship between having a mouthful of mercury poisons and chronic fatigue. Although I can't argue with the idea to have these poisons removed from the teeth or from the organism, because I can't see how they could be doing any good. But certainly as a treatment, from what I've seen on the ground, from what I've seen, I haven't seen consistent changes, but there might be. What we always see is that people with chronic fatigue and this range of symptoms invariably have a low control pause. So now, as I mentioned earlier, I'm actually going to go into this control pause a little bit more. This is very important, and it doesn't matter if you have asthma, if you have allergies, if you have chronic fatigue, if you have obesity, if you have sleep apnea, or any one of these chronic ailments, chronic conditions, which were formerly known as the diseases of civilization. What I'm about to teach you, what I'm about to explain to you, is equally relevant. The control pause measures your breathing. The control pause measures the sensitivity of your respiratory center. It is the cornerstone. It is the heart of Buteyko's approach. His discovery, his approach, and what he prescribes to augment the health and discharge chronic disease. The control pause is at the heart of it. So I'm just going to, it's a good thing that I can teach breathing, because as you can see, I'm not much of an artist. The reason why you breathe, the reason why, mechanically speaking, that you breathe is not because you require oxygen. You do require oxygen, and it's a good thing that we get oxygen when you breathe, but that is not the driving mechanism of what causes you to breathe. What causes you to breathe is a relationship between your respiratory center, which is located in what's called the medulla oblongata part of the brain, respiratory center, the level of carbon dioxide that accumulates in the bronchus alveoli, lungs, which should be at around 6% or so, roughly, and then the intercostal and vagus nerve system. So what happens is this: if you, before I go any further, in yesterday's presentation, we had some technical difficulties, and we don't know what the reason behind them was, but for some reason, everything stopped, and my studio guy here worked furiously, and we were back online within a few minutes. So if it should happen that our presentation fails or collapses or whatever, don't worry, just hang in there, and hopefully we'll be back online in a few minutes again. Okay, so here's why you breathe. You've got the respiratory center in the medulla oblongata part of the brain. You've got your lungs, bronchus, alveoli, and so forth, and you've got this intercostal muscles and so forth. If you hold your breath or you stop breathing, because your body is continuously producing carbon dioxide, the level of carbon dioxide in this alveoli, bronchus, lungs, and so forth will increase. And it should increase to about 6% or so. at which point, by some biochemical, physiological magic, which I do not understand, it sends a message to the respiratory center. And this respiratory center is in the medulla oblongata, or what's called the reptilian part of the brain, and it is a very dominant and powerful part of the brain. It produces this sensation of air hunger. It gives you that feeling of suffocation. That little part of the brain, the respiratory center, actually produces this overwhelming feeling of suffocation, air hunger. But also, it then sends a trigger down the vagus nerve system and into the intercostal muscles. So if you're trying to hold your breath, or you've forgotten to breathe, shall we say, there will be some sort of provocation of the intercostal muscles and vagus nerve system, and that, coupled with this very intense feeling of air hunger, will urge you to breathe. That's why, regardless of how entertaining the movie is, or how extraordinary the time you're having is, or how delicious something is, or regardless of how deeply you are asleep, you won't forget to breathe. You won't somehow lose interest in breathing and just stop. And this respiratory center is so powerful. Think about it. I don't want to darken the mood too much, but imagine those people who would like to commit suicide. They have to consider knives, tall buildings, automobiles, poisons, or whatever. Why can't they just hold their breath? Wouldn't that be neater and more tidy? Just sit somewhere and decide not to breathe. Because the respiratory center is much stronger than your willpower or your philosophy, beliefs, ideas, because it's in this very primal and enormously powerful part of the brain, and you can't even have any competing thoughts when you have the sensation of suffocation. So once again, let's go through this. When you're not breathing, or you've stopped breathing, or in between breaths, the level of carbon dioxide improves in the alveoli, bronchus, and so forth. That sends a message to the respiratory center. The respiratory center then produces this sensation of air hunger, suffocation, in addition to some sort of provocation to the intercostal muscles and vagus nerve system, and that is actually why you breathe. Once again, you do need oxygen, and it's a good thing that we get oxygen when we breathe, but maybe you weren't aware of this. If I were to have some magical device and I could somehow suck out the oxygen from the room that you're in as you watch this, you would not begin to have some sensation that you have a shortage of oxygen. You would not begin to pant or begin to try to breathe more. You would not feel that feeling of suffocation. You just get sleepy. You probably sort of go to sleep. You might faint even, and you'd die through lack of oxygen. If, however, I were to escalate the level of carbon dioxide in the room in which you presently sit, say I were to double it or triple the level of CO2, all of a sudden you would feel breathless. You would need to breathe more. You would feel this great urge to breathe, to take in more air, to remove that feeling of suffocation. And this goes to show that, in fact, the reason why we breathe is because, or the driving mechanism of breathing is carbon dioxide. Once again, respiratory center located in the medulla oblongata part of the brain, lungs and alveoli, they develop a higher level of CO2 when you're not breathing. Somehow, when it reaches around 6.5% or so, it sends a trigger to the respiratory center. It in turn triggers the vagus nerve system, the intercostal muscles, and produce this feeling of suffocation or air hunger. So that's why you breathe. And Professor Buteyko, in his genius, developed a technique that we can actually determine how much you breathe by measuring the sensitivity of your respiratory center, by measuring how sensitive this part of your brain is to carbon dioxide. We can mathematically deduct, on average, your ventilation. Almost in the same way, if a car travels, if it takes 1 hour for a car to travel 50 miles, what was the average speed of that car? 50 miles per hour. So in a similar way, we can actually determine your involuntary breathing pattern with a simple breath holding maneuver, which I'm going to show you now. But I'm going to clean up this cord first. Now, if you have just eaten or run up the stairs or had half a bottle of scotch or 2 espressos or something, or just taken a Ventolin or whatever, this reading may not be accurate because it's a physiological measurement, which means you should be at rest, and you shouldn't have just eaten, for example, or you shouldn't have just exerted yourself physically. But if you're sitting down calmly, and don't do it now, watch me do it a few times first, and then I'll explain to you how this works, and then we can do it together. So we want to measure how long you can hold your breath after a normal exhalation until you feel the urge to breathe. And as you may remember, that urge to breathe comes from the sensitivity of your respiratory center, because that's what we're doing now. We're going to measure the sensitivity of your respiratory center. And by doing this, we can actually determine your average ventilation. So we want to time how many seconds you can hold your breath before you feel that urge to breathe. And we're going to do it this way. Don't do it now. Just watch me first. I'm going to say breath in, breath out. Then I'm going to say hold. Then you hold your breath. And then I'm going to count the seconds as they pass. And at a certain point, you will feel some urge to breathe. As soon as you feel that urge to breathe, you should release your nose immediately. This is not a competition to see how long you can hold your breath for. This is a physiological measurement to see how many seconds it takes for your respiratory center to be triggered by the level of carbon dioxide. Don't do it yet, just watch me and I will show you again how we do it. I will say, make a breath in and make a breath out and hold. Now you're holding your breath, and I'm counting out 1, 2, 3, in the normal linear fashion, and I'm going to count, and you're holding your breath as I'm counting, and at a certain point, maybe after 10 seconds, maybe after 40 seconds, maybe after 60 seconds, whatever the case may be, you will feel some urge to breathe. You will feel some kind of, some click, some provocation will occur, some discomfort will occur. I doubt there'll be any discomfort after 1 second or 2 seconds, but maybe after 10 seconds or 15 or 20, you will feel some discomfort. At that moment, you stop and you remember how many seconds you could hold your breath for until you felt this difficulty. So we're going to do it now. So I just want you to sit in a relaxed way. Don't forget, we make a breath in and a breath out and then hold. We don't make a deep breath in and a full breath out, or a very tiny breath in and a tiny breath out. We just make a normal breath in, a normal breath out, and then hold. Okay, so this time, and don't worry if you get it wrong or you blow it, because you can do it again and check again, and we can also do it again anyway, so just relax. All right, so just relax a little bit first. Okay, so let's make a breath in and breath out and hold. 5 seconds, 7, 10 seconds, 12, 14 seconds, 15, 18, 19 seconds, 20 seconds, 23, 24 seconds, 25, 6, 7, 8, 9, 30 seconds, 34, 35 seconds, 36, 7, 8, 40 seconds, 44, 45, 46, 47, 50 seconds, 53, 54, 55 seconds, 58, 9, 60 seconds. I counted up to 60 seconds because if a person has the physiological optimal breathing, which means, according to medical textbooks, is this, can we see this? Is this good? Maybe you want to focus on this. If a person has optimal breathing, perfect breathing, breathing according to the physiological medical textbooks, they will breathe on average around 3 to 4 liters per minute, and they will have a control pause of 60 seconds. I can tell you this, any person who can effortlessly hold their breath for around 50 to 60 seconds does not have asthma, or allergies, or chronic fatigue, or angina, or high blood pressure, or bronchiectasis, or emphysema. Most certainly they don't have chronic fatigue, insomnia, and any of these diseases of civilizations. This was one of the cornerstones of Professor Buteyko's discovery. What he realized was that nobody who had optimal breathing and an optimal level of carbon dioxide suffered with any kind of chronic. They could have infectious disease, they could have congenital disease perhaps, but they could not somehow have, they did not sustain any kind of chronic disease, these diseases of civilization. So if you have a control pause of 60, I can say to you just like, best of luck, and we can't do anything for you at Buteyko Method, because basically your breathing is optimal and there's nothing for us to do except wish you well. If your control pause was around 30 seconds, that would mean that you breathe for 2 people. You breathe twice as much as you should. Can you imagine if you had double the blood pressure, or you ate for 2 people, or slept for 2 people, or you had sugar level for 2 people? It would be rather serious, wouldn't it? If you have a control pause at around 20 seconds, it means, on average, roughly speaking, you breathe for 3 people. You breathe 3 times more than you should. And as a consequence, just for the reasons of physiology, biology, biochemistry, and so forth, if you breathe 2 or 3 times more than you should expect there will be consequences. You should expect there will be defense and compensation mechanisms, damage to the organism, and the arising, according to your genetic predisposition, of one chronic disease or the other. If you have a control pause of around 10 seconds, it means you breathe for 6 people. You breathe 6 times more than you should. And you're sick, and you know it. You'll have, if you don't have asthma, you'll have allergies. If you don't have allergies, you'll have diabetes. If you don't have diabetes, you'll be overweight. If it's not overweight, you'll have fatigue. If it's not fatigue, you'll have migraines. It'll be one thing or the other. And you'll be ill and you'll be regularly seeing the doctor. If you're a young person, maybe because, you know, as we get older, we lose more and more CO2 and the levels drop. So you may not have very serious diseases yet, but they will occur not because of any sort of negative thinking or, you know, fear-mongering, but because it's just biochemistry, it's just physiology. If you breathe 6 times more than you should, you will have all kinds of health problems. One person can have asthma, somebody else can have bronchiectasis, someone else can develop cystic fibrosis, someone else can develop obesity, stupidity, depression, or whatever the condition is. That is up to our genetic predisposition, essentially. Now, genetic predisposition does not mean that you must suffer that disease to which you are genetically predisposed to. We are all genetically predisposed to bleed to death if we are cut. If someone slits your throat, you're going to bleed to death because you're genetically predisposed that way. We all are. But you won't bleed to death unless your throat is slit, unless some injury like that occurs. Likewise, even if you have the genetic predisposition to chronic fatigue, fibromyalgia, asthma, snoring, sleep apnea, it needs the cofactor of the hyperventilation. It needs the loss of CO2 for that disease to arise. If you have a control pause of 5 seconds, it means you breathe. Well, actually, when control pause is around this area, virtually it's time to call 911. If you go to a hospital and you go to the maternity ward where you'll see the little babies, I mean, you can't do this, they'll put you in jail, of course, but what you could do, theoretically, is you could get one of these newborn babies, brand new, just born, and pinch their nose and keep their mouth closed, and you will find that they can hold their breath for minutes. They can happily not breathe for several minutes. Ask any mother of a newborn child about, has she ever experienced the tremendous wave of fear when she sees her child sleeping and it is breathing so gently, so softly that she thinks it's stopped. That's how subtle, that's how light, that's how delicate and refined their breathing is. Now from the maternity ward, after observing how babies breathe, like, look, it's invisible, it's not detectable, their breathing, it's so light. Now go to the ward for the terminally ill, and this is where Professor Buteyko made, or where he had, an epiphany about his ideas and the method and so forth. Nurses know a great deal more than doctors about some things because they actually spend more time with patients. And when Professor Buteyko spoke to the nursing staff, he discovered that these old Russian nurses could look at a terminally ill person and basically know how long they had to live. They could sort of just, say, oh, he'll be gone tomorrow or tonight, or he's got a few more days left, because they instinctively knew about the breathing without even being aware that they were watching the breathing. So this, in the time of death, when the organism is about to, when the pH is shifted to alkalosis, and death is coming, the breathing becomes enormous. And Buteyko realized, look at this, the end of life, gasping for air, breathless, can't catch their breath. It even develops into a thing called chain stoke breathing. And now look at a newborn, brimming full with carbon dioxide and can effortlessly hold their breath. I mean, I'm sure you're all aware that one trick to get a child to swim is when they're a baby, just throw them in the pool. And they actually learn to swim before they need to breathe. So that's how, and as we get older, as we get poisoned, as we develop stress, perhaps some ineffective philosophies, we've been exploited or we've been poisoned or whatever the multifactorial number of things arise in which our health is impinged upon, our breathing becomes deeper, our control pause gets lower, the level of carbon dioxide reduces, and now the organism is struggling, trying to find ways to defend and compensate against the loss of CO2, and then it can't really cope with infections and toxins, and so you end up with this cascade of health problems. So I think some people are asking some questions. I will try to answer them. No, they're not questions. It's just a message. You sent me a message, excuse me. Sending me a message. Oh, okay, great. Well, some of you are sending in your control pauses. This is very good. Judy, 25. Well, you're not having. You're just to improve your breathing is not going to be difficult because 25. I should say at this point, Professor Buteyko became absolutely obsessed. I want to talk about this for a minute. He became absolutely obsessed about his discovery. And I should talk a little bit about Professor Buteyko. He was not a standard medical Russian doctor. The Soviet Union was a sort of military regime, if you will. And your regular, fully qualified medical doctor would have the rank or the equivalency in rank in the military of a second lieutenant. If that doctor was managing a large hospital and had many people under his command, he might have the rank of captain. Professor Buteyko had the equivalency of a 3-star general. His rank was called that of academician. He was an extremely bright medical student, so bright that he was taken to a special highest sort of institute for medical research and so forth. And as a student and as a doctor, he made some discoveries, and these discoveries were profound and used in the Russian military, the cosmonaut program and other things, and he was given the rank of academician. We don't have this in the West, so it's a little hard for people to sort of get this. The only people who outranked Professor Buteyko as a 3-star general and having the rank of academician would be members of the Politburo and actual military, KGB or some such generals and so forth. An academician was a very, very special person. An academician, basically for the whole of their life, everything they want, everything they need, all the resources they require are handed to them on a silver plate. If you're an academician in the former Soviet Union, you're made. He is not some general practitioner, family doctor, working in some clinic in Moscow or something. He was an academician and an absolute genius. All the reports that we have around Buteyko are that he was considered by his contemporaries as serious, very serious academic. So anyway, he became completely obsessed about his method because what he saw the control pause falling. He saw the control pause deteriorating. He saw control pause becoming worse. Now, there might be many reasons why this was happening. Maybe it's pollution, maybe it's stress, Maybe it's some sort of philosophical issues. Maybe it's to do with diet. Maybe it's to do with mercury fillings. Maybe I don't. Who knows? But what he saw, that the control pause was falling. He said that when the average control pause of a society becomes 15 seconds, that society will collapse, because the level of mental, physical inefficiency will be such that the society cannot sustain itself. When he made his discovery, he believed, and I should point out at this time, he had tremendous access to the military, to the Air Force, and to the hospital system. So when he did research and when he required equipment to do things, it was available to him. He believed that the average control pause was around 35, and in rural areas, maybe a little higher. When I began teaching this method in Australia a little bit more than 20 years ago, the average control pause was around 20. When I do workshops live and online in London and Holland and other places, in Western countries in particular, we see control pauses 12, 17, 16, 20, 18, and it is continuing to drop and get lower and lower. There are some theories as to why. I mean, you could join certain dots together, but ultimately it doesn't matter why. I mean, obviously, you should make investigation of what makes the breathing worse and try to avoid it. But if your control pause is much lower than it should be, and you're suffering health issues, your first objective should be to grow your control pause, should be to change your breathing pattern. Now, I know that this talk is specifically about chronic fatigue, and a lot of people who have chronic fatigue have this fibromyalgia and ranges of other symptoms and so forth. I can say this plainly: I've seen thousands of people with these complaints. Invariably, basically every time, they improve. Their condition improves. However, if the condition is quite a deep one, and if the control pause when they start is quite low, after they get their first wave of improvement, like for the first time, perhaps in months or years, they feel bright. They feel reasonably strong for a change. They, feel like maybe something is shifting. Well, shortly after that, their condition deteriorates again, and a war starts between those underlying factors which are causing this condition or part of this condition, and this improved level of carbon dioxide. So I guess you could develop into thirds. A third of the people that come with these so-called chronic fatigue symptoms, they do the workshop. Within 5 days, 7 days, 10 days, they're dramatically improved, and they go on just to get better, and that's it. Another segment would be, it takes them, they see improvement within a few days or a week, and then it's a bit of a wrestle, and they have to work at it, and it takes a few months. But still, there's linear, obvious, incontrovertible improvement, and they usually are very well motivated. And we have another third, where the diseases, they are very toxic, they have other complex conditions involved. There's lots of medications. They have some emotional issues, mental issues, and it's more of a much bigger job to solve this problem out. But still, the same rule applies. Within 3 or 4 days, they are suspicious that they feel maybe something goes their way. And if they continue to work, they get some results. But they will have a sanogenesis or cleansing reactions quite often, and they're often not very pleasant, but they come and go, and there's that linear relationship between their control pause and their condition holds fast. Some people have sent in their control pauses. Judy sent in control pause 25. 25 is not a great control pause, but it's not a difficult control pause to improve. So I don't know that your condition is, if you took your control pause accurately and you let go at the first difficulty, then I don't see, if you have chronic fatigue or any other of these symptoms, it's not terribly difficult. Likewise, we have Abe with a control pause of 28. Both of these control pauses are actually higher than what we normally see. We normally see very sick people. I guess that's because, you know, nobody wants to go to a workshop and practice breath holding and listen to a lot of rubbish about how to be healthy and all this kind of stuff. You'd much rather, you know, go on a holiday or something. So we usually get people who are sick. We usually get people who are in trouble, people whose lives have hit a bit of a brick wall. But as the control pause improves, as their ability to do maximum pause and forced breath holdings improve, their symptoms come off. And it's very rarely does it happen. Sometimes we get the odd person that stops for some reason which I can't explain. But most people, as soon as they've done 3 or 4 or 5 days of good coaching, regular practice, they're working hard at it, they're quite committed, then it's very obvious to them that they're on the right track. And why wouldn't you persist? Yeah, well, Judy, Apnoea has sent me some more detail. If your control pause is 25, and it's accurate control pause, which I can check with you one-to-one if you like at some later stage, it won't be difficult for you to improve your condition. And here's something interesting. These defensive mechanisms, have you has it ever occurred to you that the relationship, this might not sound on topic, but actually it is. Have you ever considered this peculiar situation where we have fairly young, middle-aged men dying of heart attack, but they have no medical history? Nothing wrong with them. No asthma, no allergies, they're not overweight. In fact, I had a patient who was a policeman in New York City, and I was giving workshops at a place called Columbus Circle, which is next to the great Central Park. And this policeman was telling me that they have a, what do you call it, like a temporary mortuary or something like that. And it's where that the police have to go every morning to do the paperwork and to sort of make arrangements for those joggers that have died, jogging in the morning. And most of them are in their 40s, 50s, otherwise healthy, no health complaints, particularly in most cases, and yet a massive heart attack. Now, interestingly, if you go around the corner from Columbus Circle and down 8th Avenue up to the mid area, you'll find all these early opener bars where you'll see all these 70-year-olds and 80-year-olds with yellow stained fingers, sick with emphysema, crotchety old, alcoholics and so forth, and they're living up to their 70s and 80s and chain smoking. And young, fit, supposedly young, fit, healthy-looking people are dropping dead from, heart attack. Now the question is, who would be the healthier? A 54-year-old executive who does yoga and who does jogging and who eats healthily, or some 75-year-old morning drinker and chain smoker? Well, you'd say obviously that the younger person who hasn't got any health complaints is the healthier, but yet he actually can succumb to a massive traumatic defense mechanism, whilst the other person with all their diseases can carry on and live a much longer life. So we can see from this that when a person has a number of conditions, it's almost the organism's attempt to spread out the defense and compensation mechanisms so that the organism can maintain its vital functions. So you've got, on the one hand, as so often we have in our classes, some late middle-aged or early elderly person, 65 years old, it's overweight, a little bit neurotic, high blood pressure, diabetic, has arthritis, and a few other conditions as well. Or we can have somebody who has only one condition, but that one condition is life-threatening. And this is the organism's attempt, according to its defense and compensation mechanisms, to keep some homeostasis. I know it sounds unusual, but we have this situation with this, as you can see, the relationship between health and fitness is not mutually exclusive. As I said, we have these elderly with emphysema, chain smokers, drinkers in their 70s and 80s, still alive, hobbling around, lots of health complaints, and we compare that to someone like Flojo, who was the fastest woman, I believe she was a sprinter, in the world. She was a black woman, very attractive. She was known for wearing a bit of jewelry, which is unusual for athletes apparently. And she apparently was the fastest woman in the world. And she died from a massive respiratory trauma. So people's ideas on how the organism works and what health is and what fitness is and this biology and biochemistry are not necessarily in sync with what's really going on. So in the case of Judy, you've got lots of symptoms there. They can all be dramatically improved as you improve your control pause. You'd need to do a proper workshop. You'd need to develop what's called forced breath holding pauses or maximum pauses. And I would suggest that all the symptoms that you've written down to me can be reversed. But I also do have some suspicion that maybe your control pause is not quite 25. It's possible, it could be, but usually control pauses with these sorts of conditions, like anxiety and so forth, are a bit lower than that. I think I'll open up if there are any questions. Okay. Workshops. Yes. So if you go to our events page, you will see that there are workshops. We've got a 5-day workshop, and we do this on a video conferencing system. So it's like a group of people, no more than 10. We have a maximum of 10 people in a class, and myself or one of my practitioners. Mind you, I keep a close eye on how the workshops are going. You work together, and you practice breath holding, and you practice. You learn and are coached in Buteyko's ideas, how to improve your breathing, how to overcome your symptoms, and how to, most importantly, improve your control pause. And we've got a 5-day workshop. We've got a workshop that goes over 2 weeks, and we've got a workshop that goes over 1 month. If you're not really that, because the prices vary obviously, so you might say, I'm not sure that I want to commit to a 1-month course. Don't worry, you can do the 1-week course, and in that time you should already see for yourself some improvement, and then you can make a decision if you need to do more work. So you don't need to overcommit. But generally speaking, those people with emphysema, COPD, lupus, multiple sclerosis, serious chronic health problems, control pause less than 20, I would recommend the 1 month course. However, you will get tremendous benefit from a 2-week course, and it may well be enough to solve out your problems. And those who are pretty healthy, or control pause well, above 25 and so forth, I think the 5-day course is well enough. But those who are unsure about what degree they want to commit to this, and you just want to stick your toe in, so to speak, then I can recommend that you just do the 5-day course just to see how it works for you. We also have one-to-one training because our courses may not be convenient, although we're going to be trying to do different courses in the different time zones that hopefully will accommodate as many people as possible. We've got courses for children. We'll be running courses specifically for those with emphysema and COPD. Generally speaking, with chronic fatigue, I'd recommend the 2 weeks or 1 month. But as I said, if you only want to make a small commitment to see if this is for you, and if it yields some results, try the 5-day course. At least you'll know if you're on the right track or not. Right. Hi Patrick. How does the Buteyko method go about reversing chronic fatigue? I've just been talking about that for the last hour. Okay, but I'll try to, in essential terms, according to Buteyko's idea and what I've seen in my own practice over the last 2 decades, is that all people with chronic fatigue have a less than optimal control pause. It means they breathe too much. And when their breathing improves, their immune system improves consequently, their ability to discharge poisons and toxins and infections improves, their metabolic rate improves, blood pressure normalizes, and they basically can reverse the symptoms. Chronic fatigue really is a catchphrase for a group of symptoms. I can't really, malaria, we know what malaria is. There is a contagion, and so you can't have malaria unless you have this malaria contagion. Chronic fatigue is a description of symptoms, and that is why, just like all the chronic diseases, official medicine hasn't got a cause for it. They've given it a name, and they prescribe all kinds of treatments, and all kinds of research is being done, and health departments put out little booklets, and they develop quite fancy sort of Latin-based, Greek-based technical names for it, and lots of medications and doctors and research and everything is all. It's an industry basically around something which no one knows exactly what causes it. Well, what we know is we never ever see somebody with chronic fatigue who has a control pause of 50 or 60. Never seen it. And the Buteyko would say it doesn't happen, doesn't exist. So I'll see. But thank you for your question, Patrick. Maybe you tuned in a bit late. Elena, I've been practicing for over a year. I trained myself, although I want to do a proper training. I began with 20-second CP, but I've only increased it to 25 to 30. Well, still, it's better to have an increase than nothing. Over this period of time, and in general, it is quite erratic. Still, I practice regularly, and it's been very helpful in many ways. And my energy is much better and getting less colds. But this year I've been getting different conditions like shingles, lichen sclerosis, a skin condition. Could that be a part of the cleansing? Well, your progress has been so slow, I don't know that it would necessarily be like a violent cleansing. I need to check, because I need to really check your control pause and your maximum pause. You don't say if you're doing maximum pauses or not. But you see some improvements, and now you've got some other things going on. I mean, you see that, like, we are living in an age where everyone is trying to sell something, and most people over-promote and under-deliver. And if you're cynical, or not you, not one person in particular, but if generally people are cynical about you know, paying money and getting involved in things and so forth, they should be. They should be extremely cynical, because just look at our so-called, you know, capitalist system, or whatever you want to call it. Anyway, and I know that people would say, well, look, well, show me what to do with the breathing. How should I breathe? Why are you trying to make a meal out of this when you should just explain what to do and how to do it? Well, unfortunately, I can't. I would. Actually, I would if I could, but I can't, because it's a coaching thing. I request that you practice a certain exercise, and then I check your results, and then I analyze and feedback, and where you're doing well, I leave that alone, and where you're falling down, we try to improve that part of your practice. So it's a bit like learning the piano, learning French. The concept of learning a piano is easy. You just hit the keys in a way that's melodic, and that's it. So now you know how to learn to play the piano. How do you play golf? Just hit the ball with your club, and now you can try to take on Tiger Woods, because now you know how to play golf. So it requires coaching. It's a skill that you develop, and some people can actually do it themselves. Professor Buteyko did it himself. I've had students, they basically caught it themselves somehow and went with it. But for me, and for most people, for the vast majority, they need some objective coaching and help, reinforcement, explanation of what they're doing, what they should do, and why they should do it, and so forth. And that's what we've seen. The objective is to get your control pause up. Now, the theory of Buddhism, simply put, is that you should not think, or think less, or somehow not be too much attached to the mind. So it's very simple. I just told you what it is. And that's basically all it is. And yet, there have been thousands and thousands of books written on how not to think. Yeah? So, with Buteyko Method, it's a skill. And some people, because of their medications, their circumstances, their symptoms, they need a lot of intensive coaching and help, and other people don't need so much. So we are not trying to, you know, we've got some magical breathing method that we're going to keep away from you, and that you have to pay money in order that we will tell you what the magic. No, it's not that. It's basically coaching and developing your skills, breath holding skills, and learning Buteyko's ideas on how to live your life so that your control pause improves and so that you can discharge your disease. I don't want to say it's very complicated, but it is somehow very complicated. And actually, it's not that the breathing will cure your chronic fatigue or your asthma or your allergies or anything else. It's that your breathing regulates your levels of CO2. It's your CO2 that is the problem, the deficiency of CO2. Professor Buteyko said that if we lived on this earth in an environment of around 4 to 5% CO2, breathe how you like. Don't worry about your breathing. You'll be fine, because your organism will always have an ample amount of CO2. But as it stands, we live on a planet where there is 0.035% CO2. As a consequence, if we overbreathe, we will lose our carbon dioxide. So in a way, you could say it's true for those who are cynical about the breathing. And let's be realistic. How could you treat diabetes with your breathing? How could you treat chronic fatigue with your breathing? What's breathing got to do with chronic fatigue? Well, the mechanical action of breathing has nothing to do with chronic fatigue, but the results of how you breathe and the biochemical result, particularly in the way of the levels of CO2, has everything to do with the way that you breathe. So Buteyko's ideas and this method is about normalizing the level of CO2, and the way that Buteyko developed to normalize and improve the level of CO2 within the human organism was to change your breathing pattern to make it within the physiologically recommended norms, because that will maintain an optimal level of carbon dioxide. I think we have some more questions. Jitendra asks, is there a device recommended to measure, control breath pause? You can buy a capnometer, but the control pause is the best. You might find this amusing. I brought my teacher, Alexander Stolmatsky, to, I think it was Prince Alfred Hospital in Sydney. And we were discussing this with his doctors because we had some publicity on television and they were somehow interested a little bit. And there were a couple of respiratory guys and guys that do clinical measurements there and so forth. And they were talking about how they measure the level of CO2 in the organism. It's very complicated, very difficult. And they were also talking about spirometry, which is this kind of medical technology whereby you breathe through hoses and they can even put you in what's called a body box. It's a very elaborate procedure. And when Stolmatsky showed them the control pause and explained it to them and so forth, and then they checked it to see if it was accurate or not, there was like this disgust. There was like they were upset actually. It's a bit like if you've got this elaborate contraption that's cost you, hundreds of thousands of dollars, and you need to have a PhD in order to operate it, and it's so complicated, and the computer's wearing out, and it's spitting out these very complicated readings, and it's all very, very highly technical, and someone comes along with a stick and can do the same thing, So Stolmatsky, with his stopwatch and his breath holding, done in a very certain way, and applied with this basic formula, this is a simplified version, could actually be virtually as accurate, even in some cases more accurate almost, and also save a vast amount of time than all this equipment. So I would recommend the control pause. It's very simple. You make a breath in, you make a breath out. You hold your breath. You record the number of seconds that transpire, and as soon as you feel the first urge to breathe, you know that your respiratory center has been triggered. You let go at that point, and your control pause was 10, 17, 20, 30, or whatever. You divide it into 60, which is the optimal, and you can see your average rate of respiration. If you've just had a double espresso or half a bottle of scotch, or you've just woken up, or you've just had food, or you've just exerted yourself physically, well, of course, it's not going to be accurate, because blood pressure wouldn't be accurate, pulse wouldn't be accurate, or any other physiological measurement wouldn't be accurate under those circumstances. Okay, I'm seeing. Question from Abe, could you say something about tooth cavity needing fillings and breath, also dust in bedroom and breath control pause? Yeah, teeth which are infected or dead are a disaster for the breathing because they produce persistent and continual systemic infection. Professor Buteyko believed that if there was any problem with a tooth whatsoever, it should be removed. He had all his teeth removed, and many of the practitioners who worked with him had their teeth removed. He was extremely skeptical. He was extremely cautious around teeth. He believed they were very, very dangerous. Interestingly, according to him, and I've seen this again and again, I've yet to find any exception to this rule, all people with very serious autoimmune disorders, lupus, multiple sclerosis, always have dead teeth or some teeth problems. So tooth is tonsils is a big problem, adenoids is a problem, teeth is a very serious problem. Doesn't mean you have to have the tooth out if it requires a filling, but if the tooth is dead, then Buteyko would be adamant that the tooth needs to be removed. Abe also spoke about dust in the bedroom and breath control pause. You know, when your control pause improves, you're not concerned about normal levels of dust, dogs, cats, birds, for dust, mite, all this kind of stuff. It won't bother you. I mean, if it's extremely dusty, well, then that's something else. But generally, if your breathing is good, normal levels or even slightly higher levels of dust or pollens and so forth won't have any effect. I mean, the control pause of contemporary society is falling. And for those who are watching who are elderly, or if you've got some contacts or friends or family who are elderly, talk to them about what a pub used to look like 30 years ago. It was like heavy industry in there. Everyone was smoking. The air is dense with smoke. And asthma, migraines, depression, allergies, it's not really happening much. And these days, if you're in Los Angeles and you're smoking on the footpath somewhere, someone across the road has an allergic attack and will have you arrested for terrorism or something. So as you can see, the threshold of excitability with allergic reactions is growing. And it was always a big conundrum in countries that are very polluted against countries that are very not polluted. Why is it that the Switzerland has more asthma and allergies and cardiovascular disease than East Germany used to have? And East Germany is a polluted disaster area, and Switzerland is comparatively clean. So New Zealand, perhaps, I'm just guessing now, probably the cleanest country on the planet. And yet their incidence of asthma and allergies and all these chronic diseases are amongst the highest. It's also a rich country, so you get lots of medications, and that usually, helps the disease to get worse. Judy asks, breathing has been my bugbear for a long time. When training to be a hypnotist, I had to avoid breathing techniques for relaxation as it could bring on a panic attack. I try to avoid thinking about breathing as it increases my anxiety. Perhaps it's something I need to break through. Check your control pause, grow your control pause, do a course, learn to do maximum pauses, learn to develop skills of breath control, and you'll find that all this anxiety and panic stuff, it comes off very easily. E. I haven't seen the 2 and 4 week courses on your site yet. Have I missed them, or are they to come? If you go to, sorry?
You can say if I have typed it up.
You answered the question. Oh, so you got an answer from Abner. Sorry, just talk to me, Abner. It's all right. They know that you're there. Jitendra asks, does this method help cancer patients? The word cancer is improper to describe the varieties of what they call cancer. I've had about 30 or 40 cases that I've dealt with myself. We usually refer them to one of our Russian practitioners, and it's not all, as sometimes it's been very good, and most of the time not. Cancers which develop, it's as though the method is not fast enough to catch the cancer. If it's a slow developing cancer, yes, it would seem, brain tumors and so forth, seems to be effective with the method. But if it's cancers which are related to the genital region, they're usually too aggressive. And so I tried to work with a girl with a cancer developing around the aorta and the heart, and she was doing pauses and she was working, but we couldn't get our momentum quickly enough because the cancer was going faster. So I don't want to say that it's a, Buteyko would say, and I'm sure he's right, that if you have a high control pause, you're not developing cancer. And that cancer only occurs with people with low control pause. And that if you can get your control pause up, before this cancerous growth becomes life-threatening, then yeah, I think it would be helpful. But I'm not going to say, it's not like asthma, put it that way. You can give me any asthma patient, if they do what they're told, that's it, out of the way. Much the same with chronic fatigue, much the same with diabetes type 2. Type 1 is a little different, of course, and all these other chronic problems. But cancer, the ones where we had very easy, very successful with brain tumors, they shrink somehow. I don't know if they disappeared. I don't know, but I do know that they began to reduce in size. Buteyko had some strong ideas on how it should be treated. I know that it's effective, and it was used in Chernobyl in Russia. Buteyko went to Chernobyl during this nuclear disaster, and so radiation poisoning was very positively affected with the Buteyko method. But you know, I would look at any case, and I would see and I would speak to our Russian practitioners to see what their opinion was. But I can't comment, you know, I can't give a blanket comment on cancer, I'm afraid, Jitendra. Abe asks, what is the maximum pause? Maximum pause is a maximum breath holding. We hold your breath for as long as you can. In the yoga, it's called the Kumbhaka practice. And it's something that has to be used in a very particular way, in a very prescribed way. It's not a health thing where you just hold your breath, you know, because you think it's good for you. It must be done with a very particular purpose in a sequence, because what you want to do is retrain your respiratory center. You want to make your respiratory center less sensitive to carbon dioxide. So it's something that is integral in a part of the training. It's one part of the training, but you won't get results without maximum pauses. You have to do them. You have to be coached in them. You have to learn techniques so you can extend them. And it's not just holding your breath for as long as you can. I mean, it actually requires, you have to build momentum in your practice and so forth. I think that's it, is it? Okay. Well, I would like to thank you very much for everybody who's been watching, and particularly those who have been asking questions. I hope I've been able to answer them properly. I would encourage you all to be in contact with us if you have queries, if you're interested in attending one of our workshops, or even if you just want to know more. We are very happy to provide one-to-one consultations if you require that. And so thank you again. This is Learn Buteyko TV signing out. In, what is it, 2 hours from now? 10 o'clock? Yeah. In 1.5 roughly hours, we have another presentation where we're going to talk about the Learn Buteyko Basic Workshop. What's in it? What do we teach? And there I'm going to once again explain the control pause, and I'll probably also, if I've got the time, explain a little bit about Professor Buteyko's shallow breathing technique, and it's called the 5 fingers. So, oh, I've got another question.
Asthma.
He asks, is there a greater content in terms of technique in the 2 and 4 week courses, or is it a question of pace? Probably a bit of both, actually. To do pauses of 40-50 seconds, maximum pauses, and pauses of 1.5-2 minutes, it's essentially the same thing. But the technique involved to achieve a much bigger result is much more involved. So if you, there is more technique. There are more. When yogis practice Kumbhaka practice, it's usually a lifetime of practice actually to develop skills. So you could have courses that go on forever, but we essentially focus on to get people just enough to reverse their diseases and just enough to bring up their control pause so that they can see cause and effect. But yes, it would be the case. There would be more techniques and more supervision and more coaching and more depth of practice in a longer course than a shorter course, primarily because we just don't have the time and you haven't done enough work to introduce the additional techniques. I think that's it. It's time for a cup of tea. Okay. Thank you again for tuning in to this presentation on the Buteyko Method. I hope you found it useful and interesting, and we welcome you to also come to our next course in 1 hour and 10 minutes, I believe it is. 1 hour and 10 minutes, which will be about our Learn Buteyko basic course. Okay, bye-bye.